Okay, today I discuss about streptococcal glomerulonephritis. So nephritis mean inflammation of nephron. So this is streptococcal glomerulonephritis is basically the nephritic syndrome that occur after group E streptococcus infection. After the several weeks of group A streptococcus infection, which may be throat infection, pharyngitis, or skin infection, that is a impetigo, right? Okay, so the pathophysiology is a very important of the streptococcal glomerulonephritis. It is a basically due to glomerular basement membrane immune complex deposition. So these immune complex deposition that take place in the glomerular basement membrane lead to the decreased GFR. So decreased GFR mean increase serum creatinine. So increase serum creatinine due to decrease GFR, and decrease sodium excretion mean increase sodium retention. This increased sodium retention will lead to hypertension, increased blood pressure, right? And this sodium may retain the water and it will lead to the again hypertension. Okay, so this glomerular based membrane immune complex deposition also damage the subepithelial podocyte. So subepithelial podocyte, when damaged, it will lead to hematuria, blood in the urine, and proteinuria. So protein lost in the urine. So when protein is lost, so what will happen? It will decrease oncotic pressure. Decrease oncotic pressure. When decrease oncotic pressure, it will lead to edema, right? So again, one high yield stuff, that is a C3 and CH50, that is a complement accumulation. So in streptococcal glomerulonephritis, C3 and CH450 will be decreased because they are accumulated. Okay, so how will the patient present in the glomerulonephritis? So it may be asymptomatic and it will be symptomatic. So symptomatic presentation is typically present with a gross hematuria. So gross hematuria, it may be tea color or cola color urine. So cola color urine, right? So edema, that may be periorbital, periorbital edema or generalized edema. So hypertension, last we already know about how the glomerulonephritis will lead the hypertension. So labs, this the labs of streptococcal glomerulonephritis. So urine analysis, so protein in the blood, protein in the urine, that is a proteinuria, and RBC casts in the urine. So in serum, what you will find in the serum? Increase creatinine, decrease C3 and CH50 complement. Maybe in some cases C4 will also decrease, and positive streptozyme tests. Okay, so treatment of the streptococcal glomerulonephritis. It is a sportive volume overload is treated by loop diuretics, that is a very high yield. Loop diuretics. Hypertension is treated by antihypertensive drugs, while the refractory cases of streptococcal glomerulonephritis will be treated by dialysis. So dialysis in case of refractory. Okay, so the last slide is a prognosis. So in case of the children, so children it completely recover. So children completely recover in few weeks. While in case of adult, likely to develop chronic kidney disease.